Hello guys, welcome back to my YouTube channel. From this video I am going to discuss about how to describe a bone. Basically here I will discuss about the humerus. So before you describing any of the bone in the body, you have to determine the side of the bone. That means whether this bone is belongs to right side of the body or whether this bone is belongs to left side of the body. So, when you determining the side of the bone, you have to know what are the structures or what are the features in the ends of the bone. That means, for an example, if it is humerus, as it is long bone, what are the features in the upper end of the humerus? You have to know, and also you have to know what are the features in the lower end of the humerus. Not only that, you have to know what are the features in the posterior aspect and also what are the features in the anterior aspect, as well as what are the features in the medial aspect, as well as what are the features in the lateral aspect. Like that, you have to know what are the features relevant to those aspects. Then you can tell the side of the bone. Let's see what is the side of this humerus. You know, the upper end of the humerus is made up of head. It has a rounded head. So this is the head of the humerus. So this is the upper end of the humerus. Then lower end, it has expanded from side to side. So this is the lower end of the humerus. Now you know upper end of the humerus and lower end of the humerus. Now we have to know what features belongs to the medial aspect or the lateral aspect. Here, this is the head of the humerus. This head of the humerus is directed medially, upward and backwards. Medially, upwards and backwards. So, this side is medial and this side is lateral. So, this bone is belongs to the right side of the body. After you determining the side of the bone, you can describe the bone in a methodical way. It is easier for you as well as it is easier for the examiner, um, because when you describe the bone in a methodical way, examiner will also be highly impressed on you, as well as it is easier when remembering the features of the bone. First, you can start like this. In the humerus, there is an upper end, lower end, and also a shaft. So, I will discuss first about the upper end of the humerus. Like that, you can start. Now, let's see what are the features belongs to the upper end of the humerus. Here is the head of the humerus. Here you can see the neck of the humerus. We call this neck as anatomical neck, because this anatomical neck of the humerus is the line which separates head from the rest of the upper end. Here is the rest of the upper end. So it separates upper end and the head of the humerus. Then there is an elevation in the anterior aspect of the upper end. It is called as lesser tubercle. There is an elevation in the lateral aspect of the upper end. It is called as greater tubercle. And also, you can see there is a groove. There is a groove-like thing in between those two tubercles. This groove is situated in between greater tubercle and lesser tubercle. So, the name is given for that is Intertubercular Sulcus. Or it is also called as Bicipital Groove, because the tendon which forms the large long head of the biceps brachii muscle goes through this intertubercular sulcus, because the tendon which forms the long head of the biceps brachialis muscle goes through this intertubercular sulcus. This sulcus is also called as bicipital groove. There is another structure in the upper end of the humerus, that is surgical neck. In this area, there is surgical neck of the humerus. This is surgical neck. This surgical neck is the line which separates upper end of the humerus. This is the upper end of the humerus from the shaft of the humerus. This is the shaft of the humerus. So, surgical neck separates upper end of the humerus from the shaft of the humerus. There is an important relation with regards to this surgical neck. Those are the axillary nerve and the anterior circumflex humeral artery and posterior circumflex humeral artery. Anterior and posterior circumflex humeral arteries are the branches which arise from the third part of the axillary artery. They forms an anastomosis around the surgical neck. This surgical neck is a vulnerable site for fractures. So, if there is a fracture of the surgical neck occurs, there is damage to axillary nerve. Because of the axillary nerve gives innervation to the deltoid muscle, if there is a damage to the axillary nerve, what happens is the nerve supply to the deltoid muscle get disrupted. So what happens is the deltoid muscle get wasted. The function of the deltoid muscle is disrupted. So that is about the upper end of the humerus. Now let's see the features in the shaft of the humerus. Here in this area, it is the shaft of the humerus. In the shaft of the humerus, if we take a cross section from the upper part, it shows a rounded or circular shaped cross section. And if you cut from the lower end, it gives like a triangular shaped cross section. So in the lower end, we can see there are three borders as lateral border, anterior border and medial border. This is lateral border, medial border and anterior border. First, we will see the structures, the features in the upper end of the shaft. Here, in the anterolateral surface of the humerus, in the upper end, in this area, it has roughened. It has roughened in this area. We call it as deltoid tuberosity. This area is roughened because of the insertion of the deltoid muscle. In the posterior aspect, here you can see a groove. There is a groove. It is called as radial groove. It is in the posterior aspect. It is called as radial groove because the radial nerve goes in this radial groove by accompanying the profunda brachii artery. This radial groove ends at the deltoid tuberosity. Here is the deltoid tuberosity. Now let's see what are the features in the lower end of the shaft. I told you earlier as well, the lower end of the shaft has a triangular shaped cross section. So, here you can see the lateral border, anterior border and medial border. This lateral border is more sharp border and it continues as lateral supracondylar ridge. Lateral supracondylar ridge. Medial border continues as medial supracondylar ridge. Because of the three borders, you can see like this here, there are three borders. We can see there are three surfaces as well. So, this surface is anterolateral surface. Anterolateral surface. This surface is anteromedial surface. Anteromedial surface. Then the posterior surface is here. Posterior surface. Anterolateral surface, anteromedial surface and posterior surface. Those are the things you have to remember about the shaft of the humerus. Let's see the lower end of the humerus. This is the lower end of the humerus. Lower end of the humerus, there are two parts as articular parts and non-articular parts. Articular parts and non-articular parts. There are two articular parts. Those are, this is capitulum, and this is trochlea. Those are the two articular parts. Capitulum, you can see it is a rounded projection. It is rounded projection and it articulates with the head of the radius, forming a radiohumeral joint. And the trochlea is a pulley-shaped articular surface. It is a pulley-shaped articular surface that articulate with the trochlear notch of the ulna, forming humero-ulnar joint. Then, those are the articular points. There are several non-articular points as well. Here I told you earlier, this is the lateral border and it continues as the lateral supracondylar ridge. It is one non-articular point. This is the medial border and it continues as medial supracondylar ridge. This is 2. Then there are two bony projections. Here you can see this projection is called as medial epicondyle and this projection is called as lateral epicondyle. You can see the medial epicondyle is the more prominent one than the lateral epicondyle. Those are the 4 parts. And also there are 3 fossae. Those are, this is the radial fossa. Radial fossa. Radial fossa is a depression which presents just above the lower end. Just above the capitulum. Radial fossa is a depression which presents anterior and just above the capitulum. And this is the coronoid fossa. Coronoid fossa. Coronoid fossa is a depression which presents above the trochlea anteriorly. Here is the posterior aspect of the lower end and this is the olecranon fossa. Third one, olecranon fossa. It is a depression above the trochlea which present in the posterior aspect. This olecranon fossa gets its name because the olecranon process of the ulna accommodates in this olecranon fossa. Here you can see how the olecranon process of the ulna accommodates in the olecranon fossa. Here you can see the 2 other fossae, radial fossa and the coronoid fossa. This is the coronoid fossa and this is the coronoid tubercle. This coronoid process accommodates in this coronoid fossa during the flexion of the elbow joint. Those are the things that you should discuss during the description of the humerus. And also you can tell this rounded head of the humerus forms the shoulder joint by articulating with the glenoid fossa of the scapula. And the lower end of the humerus forms the elbow joint by articulating with the radius and the ulna. Now let's see what are the clinical correlations with this bone. In this picture you can see the fracture in the surgical neck. I told you earlier as well what happens if there is a fracture in the surgical neck. Uh, then this is a fracture in the supracondylar area, supracondylar fracture. That means it is in the supracondylar area. If there is a fracture in the supracondylar area, because of the median nerve goes anteriorly to the lower end of the humerus, when there is a fracture, the median nerve can also get damaged. So, if the median nerve get damaged, the nerve supply to the muscles in the forearm also lost. So, the action of those muscles also lost. There is another important thing that you have to know. Those other muscle attachments to the bone, they can be asked in anatomy spots and also in vivas. Here, the blue color areas are the areas where a muscle get inserted, and the red color areas are the areas where muscle get origin. So, first we will discuss about the anterior aspect of the humerus. Here you can see there are several blue color areas. This is the lesser tubercle and this is the greater tubercle. You can see to the lesser tubercle subscapularis muscle is inserted. Here the greater tubercle supraspinatus muscle is inserted. Here this is the intertubercular sulcus or the bicipital groove. To the groove latissimus dorsi muscle get inserted, and this is the medial lip of the bicipital groove and this is the lateral lip of the bicipital groove. To the medial lip, teres major muscle get inserted, and to the lateral lip, pectoralis major muscle get inserted. This is the deltoid tuberosity. So, deltoid muscle get inserted to the deltoid tuberosity. Opposite to the deltoid tuberosity, in the medial aspect, there is an area which coracobrachialis muscle get inserted. And these are the muscle origins. So, the brachialis muscle origin from the lower one-third of the anterior aspect of the humerus. This is the lateral border. I told you earlier as well, lateral border continues as the lateral supracondylar ridge. So, in the lateral supracondylar ridge, upper part gives origin to the brachioradialis muscle, which is an extensor muscle in the forearm. Lower part gives origin to the extensor carpi radialis longus muscle, which is also a muscle in the extensor compartment of the forearm. Here it says common extensor tendon. That means this is the lateral epicondyle. Lateral epicondyle gives origin to the extensor muscles of the forearm. Almost all extensor muscles of the forearm, most of the extensor muscles of the forearm origin from the lateral epicondyle. That's why this name is given. Most of the muscles in the flexor compartment of the forearm origin from the medial epicondyle. That's why it says common flexor tendon. This is the common flexor origin, medial epicondyle. Here the medial supracondylar area gives origin to the humeral head of the pronator teres muscle as well. Here you can see the posterior aspect from this picture, and here is the greater tubercle. In the greater tubercle there are three facets. Supraspinatus muscle is attached to the superior facet. Infraspinatus muscle attached to the infraspinatus muscle attached to the middle facet. Teres minor muscle attached to the lower facet in the greater tubercle. And I told you when I described the humerus, there is a radial groove in the posterior aspect. From lateral to the radial groove, posterior surface gives rise to lateral head of the triceps, and medial to the radial groove, it gives rise to medial head of the triceps brachii muscle. And here in the lower end, here is the common extensor tendon, lateral epicondyle. Medial epicondyle is the common flexor tendon. And here you can see an area for the supinator muscle. Supinator is also an extensor muscle in the forearm. Here from this area the superficial head of the supinator muscle origins, and there is an area where unconeus muscle get origin. Here is that area. The unconeus muscle is also extensor muscle in the forearm. So those are the muscle attachments to the humerus. Hope you guys clearly understood how to describe the humerus as well as the clinical aspects and also the muscle attachments of the humerus. If you like this video, put a like and comment in the comment section. Thank you for watching.